and welcome to the Higher Education Access Corner. I'm your host, Tiffanie Devan, and I am super excited today to have two amazing guests with me. I have Dr. Anthony Sloan, and I have his mother, Amy Sloan, who many of you may have seen before because she is one of our fellow Higher Education Access partners. It is my first time having a mother and son duo here, so I'm super, super excited to have them, and I welcome you both to the Higher Education Access Corner.
Thank you.
Thank you. Yes, thank you for having us.
Absolutely. And then for all of our listeners, today we're focusing on our career spotlight segment. We're talking about research in the medical field, and I'm going to allow Anthony to really dig into that because that's his area of expertise. But in our career spotlight, if you haven't checked out any of them in the past, it's really about conversations with new and seasoned professionals who are going to share some insight onto their field of study and their experience. And hopefully you all get something out of it. If you're that person who's interested in going into research, this is a great discussion for you all. So Anthony, once again, welcome. And I'm going to just say for our listeners, if you can explain exactly what someone in your field does.
Yes, absolutely. And thank you for having me. When I was starting to explore career options, I was one of those students in high school that said, I want to be a doctor. I want to be a doctor. And by doctor, I said medical doctor. And at the time, going into undergrad, that's what I was going to do. And we can get into that a little more later, but once I started undergrad and I got into research, I realized that there was this whole field of biomedical research. And I learned about that through undergrad, and that's got me to where I am today. So what is biomedical research? Really, it's the research side of healthcare, right? So, obviously we have clinicians and medical doctors who see the patients, but we also have on the research side a lot of people doing work behind the scenes to come up with the new therapy or the new cancer treatment or the new Alzheimer's treatment or the new COVID vaccine. So biomedical research sort of covers that whole umbrella of research that happens behind the scenes related to human health. And it's really the hope to get what we're doing at the bench in the lab to bedside to a patient. So that's really what I do. My day to day, so I study brain tumors. So that's my field of expertise. So it's neuro-oncology, so brain tumors. So, my day to day is different than someone who studies Alzheimer's or someone who studies, vaccines or, really what I do is I'm trying to develop new therapies for brain tumors. So depending on your interest, biomedical research covers a broad range of interests. I happen to be interested in cancer and brain cancer specifically. But there's multiple different areas. So my story is just one story. It's one field. But there's, an array of different areas people can do biomedical research in. And, biomedical research happens at two different levels, right? So, universities, medical schools have a lot of labs who do biomedical research. But then there's also the industry side. So there's the pharmaceutical companies, there's the drug companies, there's, people that make the COVID vaccines like Moderna, people who have a PhD or, MD in biomedical research and want to do research, they can stay in the academic route, or they can also go in the industry route. So there's multiple different things you can do. I guess that's sort of just a 3,000 foot overview.
That's a good overview. Now I want to break it out just a little bit because you talked about the biomedical side and then you're into the brain tumors and all that. How did that get started? Like what made you, what piqued your interest to say it's the brain cancer side or the cancer side as opposed to any of the other fields that you could have chosen to research?
Yeah, so when I started undergrad, I majored in neuroscience, and really the reason was it was sort of a fluke because I was interested in psychology, but I also like biology, and neuroscience is a mixture of both, right? So there was really no rhyme or reason at the time. So my undergrad bachelor's of science degree is in neuroscience, which is the study of the brain. Once I eventually went to grad school, so I attended Case Western Reserve University School of Medicine to get a PhD in neuroscience. That's sort of where I branched off into neuro-oncology. The field of neuroscience, just like biomedical research, has a wide array of disease we study, anywhere from Alzheimer's to brain tumors to strokes to neurodegeneration, all these type of things. And so, getting into my PhD, you do rotations, sort of like you do in medical school with different doctors. I rotated in different labs. and I really like the brain tumor side of things. And that's really how I got into the neuro-oncology field.
Okay, so for someone who, a student, or maybe someone who's considering going into this field, what could you describe as like maybe a normal day-to-day like for you in layman's terms for us? And
Absolutely.
include like maybe your best part of the day or a difficult or challenging part of the day, something like that.
Yeah. So, biomedical research in general, you have to be okay with failure, right? So, we're trying to develop therapies. If it was that easy, we'd have a cure to cancer, we'd have a cure to Alzheimer's, right? So, everything we do in the lab, we always say, you fail 95% of the time and 5% of the time something works. So, so a lot of what we do every day is, experiments. So, and it's just like when you're in high school and you're doing experiments in the lab, it's really applying all those skills. So,
Mhm.
I have, as a postdoc, so I'm a postdoc, a fellow, a research fellow. So that's basically the equivalent of a medical doctor resident. I'm just on the research side. So, my day to day at this level is, a lot of trying to write papers to publish them, write grants to get funding, because that is something about biomedical research, right? Is you support yourself along the way. So yes, you work for universities, but you're responsible for grant money. So we write grants to the National Institute of Health, the government, private foundations. So I spend a lot of time doing that, and then at this point I have the pleasure of mentoring a lot of students and a lot of research technicians and assistants that work on my projects. So that's it. I interact with them daily. We plan experiments. In my field, a lot of what we do is animal work. So, a lot of, if we're testing a new therapy or we're doing a drug screen, we actually use mice for that. Um, so, working with rodents, doing, different cell culture work. I'm fortunate to be at the Cleveland Clinic where we are able to, we get patient samples and we sort of interact with patients, because obviously our goal is to, get a therapy to the patient in a clinical trial standpoint. So it's sort of, applying everything you learn in high school and science class, just at a different level, right? So doing experiments, writing reports, and publishing papers, really, that's the currency in the biomedical research field, is publishing academic papers.
What's funny about that is you described everything I did not like as a student. I don't like research. I didn't like the experiments. I didn't like that. However, there are listeners here who have that passion. And I see Amy kind of saying, yeah, you the same, Amy. That wasn't good.
No, I don't know where he came from.
Oh, so how old were you? And Amy, you can even chime in. How old was Anthony, or do you recall how old you were when you kind of said, you know what, this is where I'm headed, as you're going from high school to your first undergraduate degree? Like, I want to go into the medical field. How old do you think you were? And what sparked that interest? Was it a person? Was it a science class? Was it anything?
You remember, Anthony? He come home and
Yeah, I said I always wanted to be a doctor, that started young, but really what probably sparked that interest, and probably what got me into cancer, when I was in, I think, what would it be, a sophomore in high school, my grandpa died of cancer.
Mhm.
And I would go oftentimes with my parents to the hospital to see him, et cetera. And you really see, that's when I really said I wanted to do that, get into the healthcare field. At the time, it was, I'm going to go be a medical doctor. I'm going to go see patients. I'm going to treat them. That's what I wanted to do. But then obviously times changed, right? So I started undergrad to get my neuroscience degree, and I went to a small liberal arts school, and because of that, I was able to do work in a research lab. I was able to work with my professor and my mentor, and I really got to understand what research was. You really don't know what research is, and I think I probably hurt myself to get people to go into biomedical research when I say it's like high school science class, because it's really not, right? I mean, these are questions, and these are, what we test is what you're interested in. So, all the questions that I am testing now, I'm interested in. So at the time, I was really interested in, behavioral neuroscience and drug addiction. So I was really able to test some things in undergrad with the leadership of my advisor. And that's really where I sort of switched from, wanting to be a medical doctor to being a research doctor. And my advisor actually came to me and said, have you ever thought about getting a PhD and not going to medical school? And I hadn't. obviously. But it's sort of in that time. And I think, that's the good thing about going to a small liberal arts school. You know, it's not the most fun place, right? Because you're not going, my intuition was to go to a big like Penn State or Michigan or, go to those big schools. But by going to this small school, I was really able to get one-on-one exposure to research. And that's really what led me into this path of biomedical research.
And we're going to talk about the school selection. So I want to come back to that about, how you chose your different schools and things like that. But I want to get Amy into the conversation as well. How did you like when you first knew what Anthony wanted to go into? Were there things that you did to kind of nurture that or encourage, or did you kind of just take a back seat to say, nope, I'm going to let him navigate this?
Anthony was always the kind of student that was 10 steps ahead. So yes, because of what I do, it was easy for me to, I probably was maybe too aggressive with them sometimes. Like, you got to do this, you got to do that, like just research. But I mean, he was such a good student all through high school. And yeah, he'd come home in third grade and told his dad and I he was going to be a doctor. And we're like, okay, like any parent, okay, we'll see. And then he just had the drive. And I think students need to realize that I always, and you do the same, Tiff, when we're presenting, advisors and mentors at the colleges can be so influential to students. However, I don't think a lot of the students take advantage of that anymore because everything can be done online and everything, you know what I mean? So his mentor and advisor changed his whole path, which I thought was remarkable because kids need to take advantage. They're paying for it. It's their education. Take advantage of everything you can when you're there.
And,
So
no, go
yours,
ahead.
but when he come home, I think it was your junior year in college, Anthony, or senior year, and said he was changing his path to research. His dad and I were kind of like, that's great, because I always worried, the doctor hours and you don't have a life and all that. And he hasn't told this part of his story yet, but when he come home and said he was going to take a 2-year gap and work at a university and do research, every mom's, you're what? But you know what? I learned from him because I never knew the opportunities that would come with that. And I'll let him talk about that.
Well, that's a nice segue. So, Anthony, let's talk about gap years because just in talking prior to us doing the podcast, you did share your experience with a gap year. So let's kind of like unpack because there are a lot of different myths out there and perceptions on a gap year. And like you said, Amy, it's kind of like that gas, like, whoa, wait a minute, you want to pause? What if you don't finish? What if this happens or life's going to take over? So explain to us, for those who don't know what a gap year is, what encouraged you or who encouraged you to take a gap year and your experience with it?
Yeah. So, I was taking my gap year, that would have been back in 2015. And, they were less common than they are today. And what a gap year is basically you finish your undergrad degree and you decide to work. You get a paid position job, no matter the field. And while you're working for a year or two, you study for, the GRE or the MCAT or whatever test you need to take, the standardized test. And then you apply to your graduate program, whether it be medical school, whether it be PhD programs, et cetera. So I chose to do a gap year, yes. It probably was a shock to my parents, as my mom just expressed. So during that time, what I did is I went and worked at the University of Pittsburgh in a neuroscience lab at the medical school. I actually had the opportunity to do primate research there. And really why I wanted to do that was, I was a junior in undergrad when I decided to go into research. I was sheltered by my small liberal arts school. I didn't really know okay, yeah, this is fun. It's like I'm one-on-one with my professor, but what actually is it like to do, research at the highest level? And that's what I needed to be exposed to before I decided if that was the career path I wanted to do. So, by going to Pitt, by going to a medical school, by working in an academic lab at the highest level, I really got exposed to that. And I learned, one, what it takes to do it on a day to day. I also, I was able to help run a lab as like the lab technician manager. So, I was able to sort of learn, what it takes to have a lab by my PI at the time. A PI is a person that has a laboratory that employs people and works on specific projects. And, so it was a great experience. I did it for 2 years. And then I applied to my programs and I went on. Gap years now in 2024 are extremely common. I can tell you, in the lab here at the Cleveland Clinic that I work in, we have about every summer we would have between 10 to 20 undergraduates that are working in our lab for different reasons. They're all, going either to get a PhD, to get an MD, or to get an MD PhD degree. And, 90% of them are considering taking gap years. And, why is that? Well, because getting into medical school or getting into a funded PhD program is extremely competitive, and it's only getting more competitive, unfortunately, for young people today. So, I joke, to get into a PhD program that's completely funded, they want you to have already wrote a thesis. You know what I mean? That's just so by doing research, by getting on papers, publishing papers, by going to conferences, you build your CV to really make you a competitive applicant. Now, I say that, but that does not mean that you cannot go from undergrad directly to medical school or to PhD. We have students do it. But what I will say is, the majority nowadays take gap years, whether it's 1 year, 2 years. I mean, we have students that have taken 4 years of gap year, and then they go back. So it's really a time. I think it's a time to mature. It's a time to get out of the undergrad mindset. It's a time to really realize what it takes what the next level is going to be like, and to really ensure that you want to do that. So my PhD took 5 years. Medical school was 4 years. If you get an MD PhD, that's 8 years. That's a large portion of your life. So you should really want to really solidify that's what you want to do before you do it. So that's some of the pros to gap years. And, people have their opinion on them, but I can tell you, to get into the good school, the high tier schools, they think gap years are great. Honestly, some admissions offices actually prefer people that have taken gap years.
I'm glad you shared that experience, because so many people that I run across, there's a negative connotation to a gap year. And I think I was telling you, I'd never heard of a gap year until Barack Obama's daughter, Malia, wanted to take a gap year. And it's like, then they were talking about gap years on the news. And then when I'm out talking to students and families, what I started noticing is students would say, well, I'm going to take a gap year. And they didn't really mean a gap year. They were saying, I haven't figured out what I want to do, so I'm just going to take some time off. Excuse me. So it looks different.
Yes.
Yeah, and I think that's fine too, right? So, I was sort of knew what I thought I wanted to do, and that was the goal of my gap year. But, you taking a gap year because you don't know if you want to go to medical school or get a PhD or pharmacy school, I mean, there's nothing wrong with that, because they're completely different career paths, right? So, we can get into it a little bit, but, medical school, pharmacy school, you pay for that. Mm-hmm. So if you're not sure you want to do that, you don't want to just jump in. To getting a biomedical PhD, a lot of the programs are funded, right? So, I was fortunate in that aspect that I didn't have to pay for my schooling. I actually got a salary. But, really figuring out what you want to do is so important, because like I said, it's a large portion of your life. It's not it's a great time. It's a rewarding time, but it's hard work, right? Your weekends aren't like they typically are. You're studying, you're doing work, you're in the lab. I mean, so, really real understanding what it takes and seeing if you want to do it. And gap years help with that.
I think if I can add,
Mhm.
what was surprising that he had, like when he's in the middle of testing the animals, if it's a 30-day thing, like somebody has to go in on the weekends. You know what I mean? And do what needs done. So because I would be like, why are you going in on the weekend? And he's like, Mom, somebody has to go in every Saturday and Sunday. So it's just seeing that kind of life. Yes.
And I think that it's important that you highlighted that, because you have to, if someone's wanting to go into that, they really need to know what they're getting themselves into. So it's not something you're just going to jump into it, because there are sacrifices that are being made. There's a commitment that is there. So it is good to understand the requirements and what takes place, and what your life could look like for that span of time. Of course, there's a rewarding side to it, but there are sacrifices that you are making every single day. So thanks for sharing that, and as well as your input on that too, Amy. Excuse me, with everything. So as you're thinking about your career and where you're at right now, what particular skill sets do you think a person who wants to go into research or even the medical field would they benefit by having? What ones are key, do you think of?
Oh, I mean, some of these aren't even just for medical or
Yeah.
research. I think it's just any career I mean, communication is vital. If you cannot properly communicate with your peers and your coworkers and your mentors and people that you may oversee or mentor, you know, I mean, that's a vital skill. Um, Being a team player is extremely important. In healthcare, whether you're going to if you want to be a medical doctor, you don't. It's not just you treating that patient, but there's a whole team. There's a nurse, there's a nurse's aide, there's a physical therapist, there's an occupational therapist. There's a whole team that you need to be able to work with. And if you can't do that, it's really not what's best for the patient. And then at the research side, I mean, I work in a lab with 30 people, and we all work together. We help each other. There's multiple projects, there's multiple clinical trials, there's multiple animal studies, there's multiple things we have to do. And if you can't be a team player, we're not going to help patients by not being a team player. Then I guess the last one would just be probably adaptability. Like I said, research is failure. And I don't mean failure in a negative way. It's just finding the cure or finding the treatment takes time, and just being able to adapt as those hits come and as the results come in, and that's crucial as well. But I think all of those can be applied to other careers, not just medical or
I
research.
agree. Yeah, I agree. Amy, what about you? What sort of skill sets, just for someone, not just in the medical field, but just as you talk to students, what are some key skill sets do you think will benefit any student moving into their post-secondary life?
Motivation, taking charge, understanding it's not the parents' education, it's your education.
Mm.
I feel like I'm doing a financial aid night.
Have that?
Doing your research, like so many kids, as we know, like I want to go to this school, never even visited the school, and I want to go into this field, never even researched. Or Anthony shadowed in high school. We made a point of that, like shadowing and spending time. If you want to be a pharmacist, spend an afternoon with a pharmacist, like a nurse.
Mhm.
Just I education is so expensive these days that I think every student has to do as much research as they can before they invest, because they don't realize it. It's 17 and 18 years old, but it's an investment.
Mhm.
They need to get a good return on that investment.
Mhm. I agree with all of what both of you have said. And I really think for students, they don't always realize that these are skill sets that they're learning and should be learning in high school. It's almost like they're going to hone in and get the good communication skills, learn how to advocate for themselves, figure out these things after they're out of high school. And I think that's the time where you should really be, honing in, improving this skill set, because when you're in that post-secondary world, it's totally different. It's kind of like, okay, you're still learning, but you're out there with the rest of the folks who are already figuring it out. So those are all key characteristics, I think, that will help, like Anthony, like you said, anyone, not just that person in the medical field. Amy, something you said that's important, and I think knowing what skill sets are required. So for you, Anthony, for that student who's trying to figure it out in research, if they didn't have the opportunity to do job shadowing or anything like that, what core classes should they be aware of that they're going to need to take if they want to go into this field? And I ask that because I've had some students that say, well, I want to be an accountant. And I'm like, okay, well, what subjects do you work on? Well, I don't like math. And I'm like, really? So it's kind of like, for that student who doesn't have that opportunity to do the job shadowing or anything like that, what core classes can they expect to have to take, or subject areas are they really going to have to apply to this field?
Yeah, I mean, so, obviously, as long as you have the right prerequisites, you can get into any graduate program, whether it be MD or PhD. So, you can be an English major, but as long as you've taken 2 biologies, 2 chemistries, 2 physics, and 2 OChems, you can apply to medical school, or you can apply to get a PhD. So, to the student that doesn't have the opportunity, I would say, these biology classes or these chemistry classes or these organic chemistry classes or these physics classes are very important, right? Because it's not so important that it's going to dictate what you're going to do in your day to day in the future. but it really dictates, do you like the content of what you're going to have to learn in undergrad when you're getting your undergraduate degree. So I would really, at the high school level, really take those classes, see if you like them. As you go into undergrad, take those classes, because you're going to have to take a more complicated class at the next level.
Mhm.
And if you don't like them, that is potentially a red flag. But I would definitely, but at the same time, I wouldn't say, if you don't like one class, don't go to medical school, because I don't think it's apples to apples. I think there, you look at all the classes, look at all the content, and it's really try to make the most educated decision for yourself and what's
Mhm.
really going to make you happy. Graduate school, whether it be any of these graduate programs, you study, right?
Mhm.
You read a textbook, and if you're not excited by the content, that's going to be pretty miserable. So I think just trying to educate yourself on, inform yourself on what those classes you're going to have to take, while also saying, did I like this class when I took it in high school or undergrad?
Yeah, points. So now for that, it sounds like you've known for quite some time where you wanted to go, the path you wanted to take. For that student who has absolutely no idea where they want to go, they can't find their passion, they're having some trouble figuring out a career. Any advice for that student? And this is for both of you all, because Amy, I know you help folks with this all the time, but specifically, and you can answer as the parent, as the educator, as the guest on the podcast, and then Anthony, specific to you, because you're kind of like the one that's in the arena with it now. You've recently made your decision and you've known what you want to do. Any advice to that student or that person who wants to go back into the career field, go back into the career industry and choose something different?
You want me to go? I would just say career exploration. I mean, there's so many tools out there on the internet that kids can do, and they'll be like, well, I did that. Well, what were the results? They'll say, then I did another one. What were the results? And they're very similar. Usually your
Mhm.
likes and dislikes, we have found just with our ed planner and my smart borrowing, don't change. So like Anthony said, there's so many different avenues in every field. So I think sometimes kids just don't have the time or want to take the time to research them all. But there's so much information out there. And maybe as a freshman, if they start college, take some general ed classes, and then maybe sit in on a class, sit in on a science class, or sit in. I always tell students that when you get there, and if you're not real sure, sit in on a class that you're not taking to see if maybe that interests you, or, there's just
It's a
so,
good idea.
yeah, so
Very
much
good.
out there. What
Mhm.
do you think, Anthony?
Yeah, I mean, that's a hard one, right? Because
Hmm.
no one can tell you what you want to do with the rest of your
Right.
life.
Yes.
That's the hardest thing. But I mean, there are tools, and I obviously live in Cleveland, and we actually have a lot of high schools that have programs, to sort of introduce high school students to healthcare, biomedical research. So like every summer we have high school students in the lab. So try to use your connections. It's cliche, but use who you know. That's really, reach out, even if you don't know them, like ask your guidance counselor, ask your teacher. They know someone, and
Right.
try to do shadowing, whether it's in a research lab, whether it's a pharmacist, whether it's a medical doctor, and just spend your summers in high school doing that, and just sort of see, what can I see myself doing? I am skeptical. Like, if you don't have any idea, I don't know if I would. There's also a thing of taking a gap year before you go to undergrad.
Mhm.
Right? Because you're going to pay for that undergrad degree, and they're only getting more expensive. So there's nothing wrong with that either. And I don't. That's probably not as common as the gap year after undergrad. But there's nothing wrong with doing that and getting a job and exploring all your options before you take, because you're investing in yourself,
Mhm.
and that's the biggest thing with all these degrees. And you're investing in yourself, and if you're not 100% sure, no one else can be 100% sure for you. So really take the time and explore and use your
Absolutely.
resources.
Yep, I agree. And I agree that you're saying, it's for them. So no one else can figure it out better than what I think that individual who's searching. And another point, even if they're not in an area where they have those resources, I've told students, look in your areas of in your neighborhoods. Look at the things that you do. Maybe you want to be a doctor, but you don't know anyone. Well, you go to a doctor's office. And
Yeah.
there are so many times I tell students, ask your doctor. Most times doctors will have a conversation with you, your own. What made you want to go into this particular field of study? Can you tell me few tips, pros, cons, or something like that? Where can I go to get experience? Will you let me shadow you? A lot of times they may say no, but sometimes they may say yes. You're not in the area where there's confidential information, but sometimes they'll say, I'll let you come in today and just oversee X, Y, and Z on the outside. You never know what you can get. And I do know a few students who had that opportunity. They were in a law firm. They didn't get to the nitty gritty, but they're like, you can come into the courtroom, you can come in to do these things. And it let them know what they wanted to do, maybe what they didn't want to do. And maybe if you can figure out, hey, this is something I don't want to do, get you a little closer to finding out what you do want to do with everything. Now, I do also want to talk about the school selection piece, because you had to go to school, right? And you chose a liberal arts school for your own reasons. So when you're deciding, or for our listeners, so for someone who's trying to figure out what type of school or what schools should I look at, what influenced your decision to choose your school? Was it size, location, cost? And I'm sure Amy has a lot that she could say about this, but we'll start with you, Anthony, and then let Amy chime in.
Well, yeah, my mom helped dictate the schools I looked at. I mean, she let me look at all the schools, right? So I was able to look at the large schools. I was able to look at the smaller schools. Like she said earlier in the podcast, she's pretty blunt when it comes to, this is what this is going to cost you. This is what you're going to pay after. This is how much debt you're going to have. So, from a school selection, I was fortunate to get some academic money when I attended Westminster College, is where I went. It's the small liberal arts school in Pennsylvania. So that helped obviously persuade me, because, when you really think about, college is fun for 4 years, but then after that, you're stuck with the bill. So I think that helped persuade me, I would say some. And also just realizing, when you go to these large schools, you're a number, right? So you're going to sit in a class with 1,000 kids for your biology lecture. I knew the type of learner I was. I needed more one-on-one small interactions. So, I had to make that decision as well, as where am I going to shine or flourish the best. And, I truly do think I did make the right decision with that. But yeah, that's how Mom, anything to add?
I always say I was the mean mom and was like, no, you're not going to that big state related school. And only because we preach that. I always tell kids, apply to private school. They have $1 billion a year to give away in academic money. And so many kids shy away from the private schools because of the number that they see. But then I think he applied at 5 colleges, and it was cheaper for him to go to the private school than it was to go to the big state related school he wanted to go to. And that was hard for us because we went to a lot of games at that school and we loved it there. But as a parent, and I tell my parents this all the time, it's hard to say no sometimes, but we didn't want to co-sign loans for him that were going to be double what he needed.
Right.
And he was mad, not mad, because he never really got mad at us, but disappointed when we went over the figures, because you'll get a financial aid notification from every college that you applied to, and we sat him down and this is the bottom line. And obviously he chose Westminster, and he thanked us 4 years later when he had very little debt.
And I think
yeah, he lived on campus like the first year, and then he ended up commuting to save even more money. So, live on campus, made a lot of friends, got involved in a lot of different things. And then we're 20 miles from the school. So then he made the decision to.
And so then, Anthony, you realize your parents knew everything anyway, right? They were right from the beginning.
Yeah, right. No, but it was a good decision. And, I don't truly think I'd be where I am today if I didn't go to the school I went to, there was a lot of pros to come from that, like I've highlighted earlier. So I don't regret it at all.
Right. And so what I part of the takeaway for me from listening to both of you is kind of like know who you are, know who your kid is. For you, you already knew up front that, I'm not going to flourish in a big school where I'm just a number. I need that interaction. I need them to know who I am. And I think that's how you made some of your connections by, being in that more intimate setting. And again, Amy, with you and your knowledge, whether it came from you being the parent, you being the access partner, or the combination thereof. It's knowing how to help them navigate through this process. And I think you kind of were spot on when you were talking about the price tag. Price tags do make a difference, but also don't shy away from, exploring those private schools. Yes, they're bigger price tags, but sometimes they're packed with just as much in aid to kind of help balance it out. Sometimes, again, it works out better to go choose a different option. So keep your options open. I think for students and families who are listening, keep the options open. Don't cross any school off out of the list, but make sure you're making an affordable decision because you have to still live. You're going to go into that career and you do not want to be bogged down with student loan debt that's out there. And I've even been telling students now, like there's been so much conversation about student loan forgiveness this past year. And so some students I've been hearing saying, well, I'll just borrow a student loan. They're probably going to forgive it. I'm like, don't borrow unless you absolutely have to. And if you do borrow with the assumption that it's going to be repaid. That forgiveness thing is not a guarantee, so you don't know your path, but career exploration is key.
Yep.
I'm sorry, Annie, what'd you say? I cut
We
off.
don't know
I
the
cut off.
future from forgiveness and what'll happen. So you can't
Right.
assume that it's going to be there 5, 10 years from now. So you're exactly
Yep.
right. You got to just in your mind know
Yep.
that you're paying it back.
Yep. So Anthony, as a whole, as you kind of think about the career that you were heading into and where things were going, and I just have to ask because your mom is an access partner and she's been doing this for quite a long time. So how much do you think your wise decision making regarding your career path and your trajectory is based off of just her experience and her knowledge? Do you think it would have been different, or were you the student that says, nope, I pretty much got this and I'm navigating it in a totally different way?
I mean, obviously, I think she's helped guide me and push me gently on this path, and I don't think I would be here where I am without her and my dad's support. But you know, yeah, and she was very realistic with me, and I think that helped. So yes, I'm spoiled in that realm, right? So she does this for a living. I never filled out the FAFSA form. She did it for me. So, yes, I think I was very fortunate. But I do think there's resources out there for other kids whose mom is not an access partner for PHEAA
Absolutely.
and I think they should use those resources. I really do.
Absolutely. And if my mom were Amy Sloan with as much expertise as she had, I'd probably just go ahead and say, hey, mom, you got this. I trust you as well. Let's just go with the flow with everything. So is there anything that you think we've not covered that you all would like to venture into um, regarding the whole process and financial aid and all those key things?
No, I
We
mean,
covered
we covered a
everything.
lot.
Yeah.
And then so go ahead, Amy.
I always I end my financial aid nights this way. I always say to anybody I'm talking to, kids, students, remember it's an investment. There's no silly question asked. That's why access partners are there, financial aid
Mhm.
officers, advisors at the schools, your counselors at your high schools. People want to help. We just can't help you if the questions aren't asked.
Right. And then you kind of started because one of my final questions was going to be to you to say, you've experienced this as a parent, possibly as a student, as an access partner. And I was going to ask any advice that you would give to a student, a parent, or even an educator. So from the student's perspective, you did say it. For that parent who's trying to navigate this process, any advice for them?
Be patient and get involved. But don't dictate. I mean, guide, like Anthony said, you try to guide them one way, but as a parent, you know your child, I think, very well. And as soon as we pointed out the class sizes, and yes, he was a great student. However, he went to a small high school. He was very much go up and ask questions. So all of that comes into a realm as a parent, like just to try to guide them in the right direction and, make them apply, make them shadow, make them be involved in the whole process because it's their life and it's going to be their loans that they have to pay back.
Absolutely. Anthony, any last words from you?
Yeah, I mean, I would just say, it's a stressful time, going from high school to undergrad, to maybe a gap year, to maybe medical school or graduate school. It's stressful. You should lean on your support system, you know, really have people in your circle who support you and want to see you succeed. You know, that's vital as you go through all these years of training or whatever you may be doing. And don't give up, you know, one day at a time.
Right.
Not every day is good. Not every day is good, but there's enough good days.
I agree. I think that's a great way to end everything. I truly thank both of you for joining me on the podcast today at the Higher Education Access Corner. And again, for our listeners, there's so much information I think that you can pull out of it. Maybe you're that student or that person that's interested in going into some type of research, biomedical research, or a different path. I think Anthony gave us a lot to consider, from everything from a gap year, knowing who you are, knowing the skill sets that are required, from communication skills and team building, making sure you're a team player. I think Amy, of course, always gives great advice, and she also showed how you can support your sons and your daughters, and allow them to kind of like guide. They're the guide, but they're allowing them to navigate this process. So lots of information that you both shared. I greatly appreciate it. I thought this was fun to have the first parent and young adult on the, I won't say kid, but parent and young adult on the podcast with me here today. So again, thank you all for joining me. For all of our listeners, thank you all for joining us here at the Higher Education Access Corner, and we will see you soon.
Thank you. Bye-bye.
Thanks for having us.